There are multiple pulses you can evaluate throughout the body. There's the carotid pulse, which is located on the neck, the brachial pulse, which is located on the inside of the elbow, the radial pulse, which is located on the thumb side of the wrist, the femoral pulse, which we are not going to demonstrate, but is located in the groin. There's the popliteal pulse, which is behind the knee. Make sure that you press really deep for this one, as it can be tricky to find. There's the dorsalis pedis pulse, which is located on the top of the foot, just lateral to this tendon. You go ahead and flex your toe for me. Good. It'll be located right here. There's the posterior tibial pulse, which is located just posterior to your medial malleolus. An easy way to find it is to draw a line between the medial malleolus and the calcaneus, and you'll find it right in there. When evaluating pulses, it's important to compare them bilaterally, so you can palpate them both simultaneously. The exception for this is the carotid pulse. You never want to palpate your carotid pulses at the same time. Otherwise, you run the risk of making your patient pass out. When you're evaluating pulses, make sure you're grading them on a scale of 0 to 4+. 0 being a non-palpable pulse, and 4+ being a bounding pulse. 2+ is an expected finding. To take your patient's heart rate or pulse rate, we generally use the radial artery. First, inspect the area that you're going to be palpating. Then, take the pads of your second and third digits and place it over the area of the pulse. If you're having trouble finding the pulse, simply vary the amount of pressure that you're applying to the area. If you're still having trouble, you can use multiple pads and multiple fingers to place over the area. Then, once you think you found it, switch over to the second and third digits. To calculate the heart rate, simply count the number of pulsations over 60 seconds. Or you can count the number of pulsations over 30 seconds and multiply it by 2. The average adult heart rate is between 60 and 100 beats per minute. If it is under 60 beats per minute, that is called bradycardia. If it is over 100 beats per minute, that is called tachycardia.